So patients whose BMI is greater than 40 are not the ideal candidates for surgical therapy from our standpoint in doing the Nissen fundoplication, and it's a contraindication for the Lynx device. Those patients really need to lose weight, and we can offer something in terms of utilizing what we call the lap band, which is one of the ways that we can morbid obesity can be addressed. The key in either one is to get the weight off in treating this. And a lot of science is going into the understanding of morbid obesity, and we're becoming more and more knowledgeable about how to treat it. I think that newer techniques, newer medications will be coming out soon in the marketplace that will have something to offer that. With reflux, though, there are things that you can do for yourself. First of all, maintain a normal body weight or normal BMI. To do that, you've got to exercise, you've got to eat the right foods. You need to have at least 30 grams of fiber in your diet on a daily basis. You need to drink plenty of water and stay hydrated. You need to eat healthy and stay away from the foods that have a lot of fat, the fried foods, the fast foods that we see. Unfortunately, in our society, everybody wants something now, and or we are oftentimes pressed for time, and we try to get something quick, and it's not always the most healthy thing to do. But we also want to avoid taking medications for prolonged periods of time because there can be side effects from those medications. And we also have to understand that with the pathophysiology of reflux, it's really an anatomic problem, because the lower esophageal sphincter is a band of muscle that is at the junction of the esophagus and the stomach, near the diaphragm or just below the diaphragm, that acts as a valve that helps close down and keep those gastric juices from going up to the esophagus and preventing the reflux. But that sphincter can become destroyed over time and become weakened. Medications will not fix your hiatal They will only treat the symptoms, and you can only do that for so long. And if you continue to do that, you may be putting yourself at risk for other complications, such as Barrett's, esophageal cancer, strictures, that can be much more difficult to treat. So you want to get to that, and you want to get it taken care of earlier rather than later. It's kind of like dealing with colon cancer. You want to treat that earlier rather than later, and find those polyps before they turn into cancer.